How to understand your osteoporosis fracture risk. Understanding your risk of fracture due to osteoporosis is crucial for maintaining bone health. It involves evaluating various factors that contribute to bone fragility. The first step is a fracture risk assessment. This assessment combines clinical information, bone density measurements, and sometimes additional indicators to estimate your 10-year probability of sustaining a fracture. One widely accepted tool for this purpose is the Fracture Risk Assessment Tool, commonly known as FRAX. This tool calculates the 10-year risk of a major osteoporotic fracture, which includes hip, spine, wrist, or humerus fractures. It also specifically assesses the risk of hip fracture. FRAX uses clinical risk factors such as age, sex, weight, height, previous fractures, family history of hip fractures, smoking status, glucocorticoid use, rheumatoid arthritis, causes of secondary osteoporosis, and alcohol intake. For improved accuracy, it can also incorporate bone mineral density measurements from a dual-energy X-ray absorptiometry test. Bone mineral density testing by dual-energy X-ray absorptiometry is the standard method for diagnosing osteoporosis. A low bone mineral density indicates weaker bones and a higher risk of fractures. However, osteoporosis often remains silent until a fracture occurs. This is where risk assessment tools like FRAX become valuable. They help identify individuals who may benefit from further testing or treatment, even if their bone mineral density is not critically low. In addition to FRAX, there are other questionnaire-based screening tools available. These tools, such as the Osteoporosis Self-Assessment Tool, Osteoporosis Risk Assessment Instrument, and Simple Calculated Osteoporosis Risk Estimation, can help identify people at risk for low bone mineral density and fractures. They are particularly useful in settings where bone density testing is not readily available. It's important to note that fracture risk can vary by geographic region and population. Therefore, FRAX models are calibrated to specific country fracture and mortality rates, which enhances personalized risk prediction. Understanding your fracture risk is essential because it informs clinical decisions about prevention and treatment strategies. These strategies aim to reduce fracture incidence and the complications that can arise, such as disability, loss of independence, and increased mortality. To understand your osteoporosis fracture risk, consider the following steps. First, discuss your personal risk factors with your healthcare provider. This includes your age, family history, lifestyle, and any medical conditions you may have. Next, undergo bone mineral density testing if your provider recommends it. Utilize fracture risk assessment tools like FRAX to estimate your 10-year fracture probability. Based on your risk level, your healthcare provider may suggest lifestyle changes, dietary supplements such as calcium and vitamin D, or medications to strengthen your bones and reduce fracture risk. Regular monitoring of your bone health is also important. Reassess your risk as you age or if your health status changes. By following this structured approach, you can ensure a comprehensive evaluation of your fracture risk. This aligns with current medical standards and helps you make informed decisions regarding osteoporosis management. Always consult with your healthcare provider for personalized advice tailored to your unique situation.